In Chinese medicine, hip issues are never seen as just a joint problem. The hip sits at the crossroads of structures, hormones, stress, and stored emotions. The hips are closely related to the kidney system in TCM. Not just the physical kidneys, but the deeper energetic system that governs bones, vitality, fertility, and our foundational strength. When someone has deep dual aching hips, weakness, or stability, we often look at the kidneys depletion. This can show up after years of overwork, chronic stress, excessive in training, or long-term inflammation. It is the pattern we see in burning out, when the body's reserves have been slowly drained. But hips are also influenced by the liver system, which governs tendons and the smooth flow of qi. When hips feel tight, stuck, or flaring up during emotional stress, it often reflects liver stagnation again. Suppressed frustration, constant pressures, or holding everything together very tight can literally create tensions through the pelvic girdling. That's why hip opening practices sometimes trigger unexpected emotions. The body stores what the mind tries to manage. If the hips feel heavy, swallow, or worse in a humid weather, Chinese medicine considers what we call B syndrome, an obstruction caused by the dampness, cold, or heat in the channels. Cold damp tends to feel stiff and better with warmth. Damp heat feels more inflamed, swollen, and irritated. Energetically, the hips surround the reproductive organs and the sacral area, so when the hip pain overlaps with menstrual changes, PMS, or hormonal imbalance, we don't separate this system, we treat them as a connected. In clinic, hip issues are often a mirror. They can reflect exhaustion of the body reserves, emotional stagnation, digestive weakness, creating damp accumulation, or simple a person who has been strong too long without enough restoration. The question in Chinese medicine is never just where does it hurt? It is what has been depleted, what is stuck, and what has not been expressed.